Hello everyone, I am Dr. Sigdel. Today I'll discuss a brief psychotic disorder and its differential diagnosis. A 23-year-old woman brought to the emergency department after attempting to overdose of painkiller here 4D, following death of older brother here in a car accident. She report hearing his voice telling her to come be with me, come be with him. See shadowy figure around her room. Yesterday he became agitated while visiting his memorial site, pacing and rocking while talking about dark spirit trying to steal her soul. She has no prior psychiatric history. What is your best explanation for acute presentation? This is the question scenario here. Dark spirit trying to steal her soul. Let's try to analyze. Age 20 to 3 year. This is the lady. Come to there is overdose. See here, overdose of the prescription of the painkiller last 4 days. Time zone here 4 days. These are important data after death of her older brother. And what she become agitated here, agitated while visiting memorial site. Yes, yeah. And dark spirit trying to steal her soul. This is some of the psychotic feature. There is a psychiatric past? No. So this all is time zone here, 23 year, drag speed saying that means almost time zone. See, this is the time, very, very important. This is crucial to know time zone in psychiatric disorder. 4 day only adjustment disorder, almost 6 months. Less mixed disorder, emotion and conduct. Bereavement, I'll discuss later on. This is almost brief psychotic disorder. You can see here also. We'll discuss the one by one. Let's down go explanation. Brief psychotic disorder here is what they happen. Sudden onset of psychotic symptom. What are the psychotic symptoms here? These are the delusion, hallucination, disorganized speech or behavior. Duration should be less than 1 month. Less than 1 month. And trigger, what are the triggers? Significant stressor or traumatic event. There should be stressor and traumatic event. Treatment, acute brief psychotic disorder should be hospitalized. And they savor sometimes short-term antipsychotic medication can be used. Why not other? Let's analyze other. Adjustment disorder. For adjustment disorder, there is emotional stress needed, but no frank psychosis. Psychosis means hallucination and bizarre delusion. There is feature of something which is confirmed. Almost she went to the memorial place and she developed some dark spirit trying to steal her soul, some spirit trying to steal her soul. That is a psychotic feature. This is almost psychosis. So antipsychotic can be used. Bereavement is grief may be include transient sensory perception. Look here, this is a sensory perception. Transient sensory perception. This is not present with hallucination, delusion, and disorganized behavior. This only perception, and this is transient and sensory. Major depressive disorder with psychotic feature. Major depressive disorder means it occur for the next 2 weeks. 2 weeks of depressed mood, and there should be psychotic symptom. It's a mood congruent. There may nihilistic, guilt, or worthless. I'll discuss further later. Schizoaffective disorder. Schizo means there is a mood plus psychotic symptom. Schizo, psychotic, affective mood. almost 6 months. Separation anxiety, excessive fear of separation, especially in children. There is no psychotic feature. Key point here we have to know is brief psychotic disorder less than 1 month. Less than 1 month. Here. Brief psychotic feature, you have to know delusion, hallucination. These are consistent with person mood, depressive and manic mood. Major depressive psychotic feature I already discussed, and I'll discuss further here. Mood are two types. One is sad mood, other is elevated mood. If sad mood or hopelessness, guilty, these are the depressive mode. And psychosis match here with depression, sad mood. That are these are MDD with psychotic feature. Psychotic feature, like let's say one is I am responsible, everything suffering. That is, she's telling inside her, she is responsible. She feel guilt. This is the delusion of guilt. Other kind is my organ have rotated away. Some lady is telling that depression disorder, I'm telling my all stomach is rotating. That means nihilistic delusion. There is some voice, okay? You are worthlessness in life. You don't need now, like this kind of auditory hallucination also voice. But there are MDD with psychotic feature, most of the inside the body. Psychotic feature come after MDD, and these feature almost like organ rotating inside body, suffering. You have to remember that one. These are the negative guilty. Sometimes the bipolar disorder and manic episode with psychosis. Mania means elevated. That is grandiose. Psychosis feature here, you have to delusion grandeur. I am chosen by God. Okay? Oh, that kind of mood. Grandeur. Hallucination speaks power. I'm wealthy. I have all the power. Like that. This is an elevated mood with psychosis match. Let's briefly summarize again disorder duration cycle. Brief psychotic less than 1 month. Remember what this one, this is the fact here, okay? Only 1 month here. Brief psychotic. These are stress releases, sudden but usually absent. Schizophrenia from 1 to 6 months. You have to remember this one. Yes, 6 months. Schizoaffective more than 6 months. Schizophrenia present in milder form in the schizophrenia form. Here, persistent form in the schizophrenia. Symptom, psychotic symptom. MD with psychotic feature, this time zone, 2 week. Only during the depression, see here. Only during depression, there is psychotic feature. This is mood congruent. Remember this one, mood congruent. I'll, I'll just see the differentiating feature between brief psychotic disorder and adjustment disorder. Let's see the most important feature here. See, psychosis, hallucination, delusion. We already discussed psychosis, hallucination, delusion. If there, this is psychotic feature, brief psychotic feature. Time duration, less than 1 month. Here, adjustment is an emotional or behavior reaction. This is reality here, lost. This is a resolve. Finally, for memory, brief flash psychosis after stress, schizophrenia form. Short schizophrenia, less than 6 months. Schizoaffective, schizo plus mode. MDD with psychosis. This is occur only in psychosis, occur in depression. Bipolar disorder, psychotic break, danger, reality here also lost. In adjustment disorder, stress reaction, reality intact. These highlight the psychosis related disorder briefly. Thank you for watching. See you in the next session.